Hi everyone, I'm Hilary Solo. I'm a final year pharmacy student at Kampala International University, and I'm going to tell you today about my lived experiences with patient-centered care. First of all, to me, patient-centered care is healthcare that is respective of patients' individual needs, their economic status, and their mental health. So I'll tell you two stories. One is negative and definitely one is positive. So starting with the negative one. As a child, I had phobia for injections, and unfortunately for me, I was getting sick over and over again. So there's this time I got severe malaria in the middle of the night, and I was rushed to the nearest clinic. Unfortunately for us that day, there was just one healthcare personnel, and that was a nurse. So she diagnosed me with malaria, and she had to give me injections. So she brought a tray of 5 injections. I do not understand whether she was supposed to give me 5 injections at the same time, or she just had really tiny syringes and she had to give me a specific concentration. So she was forced to give me 5 at a go. So the nurse walks in with a tray of injections and she reconstitutes them in front of me. Definitely for a person who has phobia for injections, I started crying before she could do anything. And this nurse was busy, there were other patients, and she was alone on duty. So she tells me in my mother language, she tells me, don't waste my time, turn, I have other patients to attend to. So I was just crying, first wait, I'm not ready, all that stuff. And of course, as a child, I was really tiny. She just held me and really gave me my 5 injections at once. So the most traumatic part of that is I got really so much pain after the injections. My gluteus was paining, I could not walk, I could not sit. I was just crying over and over again for the next about 2 days. They had to nurse me with ice over again, and up to now I still have scars following those injections. And that's enough for the negative story. For the positive story still, it's about my phobia for injections. There is a nurse in a healthcare center we usually go to at home who was really sweet to us. She just had the best pediatric room all the time. She had the dolls, she had the sweets, she had the vehicles, she had the stickers and everything we needed. And she always had the things we needed to hear. She would say, how are you? How are you doing? How is school? What brought you here, Hilary? I thought you're not going to get sick again. What happened again? What went wrong? So she really involves you in your care, even as a child. She makes you understand that you're not alone in this. I'm going to help you. And then for the time for the injection, she would make sure she tells you maybe a story. And then she always had sweets. And she would say that, I'm going to inject you now. So after an injection, I'll give you a sweet. So as a child desperate for a sweet, you would definitely turn at will and should give you the injection. So the moral of the two stories for me is there's 2 sides of healthcare personnel. There's those that are respective of our needs, our mental health and everything that we fear. And then there's those that have not yet developed into the system to address their care in a patient-centered way. So it is our duty as the young generation of healthcare workers, of medical students, of pharmacy students, of nursing students, of medical lab students, that we be more mindful of patients' fears. We address patients' fears according to their individual needs. If a patient has phobia for tablets, if a patient has phobia for injections, find a way of giving them the most palatable dosage form. If a patient's mental health is at stake, talk to them, initiate them into their care, make them want to receive care. In conclusion, I hope us as the next generation of healthcare workers treat patients in a patient-centered way.